tonight's session. And take away something useful from it. We'll be focusing on dentistry, and joining us here will be Chief Executive Officer, CEO of the Dental City, Dr. Bala. He will be sharing with us here information about the field of dentistry and his experience of how he got to be where he is today. We'll start off the event tonight with a talk by Dr. Bala himself, then followed by a Q&A session at the end for everyone to clarify any doubts you all may have. Feel free to type your questions in the Slido link provided in the chat box as we proceed with the event. Kindly refrain from typing questions in the Zoom chat box. Before we begin, make sure to read the housekeeping rules posted in the chat box, and please abide by the rules, or else we will not hesitate to remove you from the meeting. Without further ado, Dr. Bala, the stage is yours.
All right, thanks so much, Sean. Thanks so much, guys, for the invitation. I know it's a weekday. I know it's post-dinner. You choose to Netflix over me, so I'm quite grateful. All right, so let's have let me just share my slides if it's okay. Let's just have a very casual chat. Sorry, Sean, is my screen clear?
Yep, clear.
All right, thanks, guys. So let's have sort of a chat about dentistry, right? So congratulations, guys. You guys are in pre-medical. Congratulations because you are in college. Trust me, you're in your best time of your life. Please, yes, you've got to figure out dentistry or medicine soon, but please enjoy your life at the current period of time, because when you come to my age, you start talking about when I was your age, right? So, you know, your college life is the sort of the best part of everything. So let's have a casual talk about dentistry. I know you guys have, you know, I believe everyone was science stream and you looked at a pre-medical course for a purpose of that is your direction. It's either medicine, it's either dentistry, or whatever the pre-medical could bring you to. So very simply, I was actually supposed to do medicine. All right. I did my dentistry in Ames University, which is in Sungai Petani, Kedah. So after my matriculation, I had a choice between medicine and dentistry. When I was so initially I decided on medicine, but eventually I moved to dentistry because I spoke to my dean, and he made dentistry sound sexy. All right, so then I said, okay. But you see, a lot of people, you know, when I was your age, literally, when we look at medicine, we think, okay, look, it's a commitment, it's work, and no play. And a lot of people did dentistry with a thought process of, okay, this may have a bit of work-life balance. You know, I finish at 5, I go back and I enjoy it. But the honest truth would be, you know, in both fields is equally demanding. Unfortunately, when you come into the working world, at the start especially, there is no such thing as work-life balance, right? It's work. Eventually, yes, you will reach to a level where there's work-life balance. So the reason why I did dentistry is because you know, I was very passionate about doing things differently. So I felt that dentistry could offer me a little bit more options in terms of clinicals compared to medicine, because medicine, the pathway was always, okay, finish medicine, join the government, specialize, and, you know, be a doctor. But dentistry at that time, it created a lot of different pathway, which I'm going to share with you, which is not really clinical at times, because I, from day one, didn't want to be a clinical dentist. So today, I do very little clinics. I do 6 hours a week maximum, all right? And I do everything else the rest of the day. So at that period of time when I was deciding medicine or dentistry, I went for dentistry because it's out a little bit of different, it gave me a different perspective compared to medicine. But did it give me the fulfillment of a medicine? Because, you know, everyone did dentistry because they were rejected in medical school. All right, that's a common, you know, literally if you go to my classroom and ask 80% of them said, yeah, we wanted medicine, but we didn't qualify. So second was dentistry. But in my case, it was first dentistry, and I was praying I don't join the medical faculty, right? But is it as demanding as the medical? Yes, because the first 2 years, all right, in medical, you call it preclinical. In dentistry, it's also called critical. The first 2 years is the exact same syllabus. So literally you'll be mugging your anatomy, physiology, biochemistry. There is not very much difference in the first 2 years. Third year, when my medical colleagues were going to hospital for attachment, that's where dentistry kicks in. All right. Now, why did I choose dentistry? Because dentistry is just not 100% science. It had a lot to do with communication. It had a lot to do with artwork. So it is a little bit of an artistic way. There's a fundamental science to everything, right? So I'll show you the subspecialty. So you will know that even in dentistry, there's hospital-based dentists that does all the facial surgeries and, babies with cleft. I will go down in my next slides on the different sort of specialists in dentistry, right? But dentistry in year 3 shows you the power of your hands, right? So you're making, you're doing etude, you're doing photography, you're doing root canal treatments, you're stopping pain, you're doing surgery. So it sort of covered quite a bit of everything I wanted to do. Medicine, it's in the same pathway, but medicine is very much consulting, right? You don't use your hands very much, except if you move into surgery or something. Dentistry is something that in a degree, I could start using my hands for my job, right? It is false to think that dentistry is just fixing tooth or just cleaning teeth, because the science of dentistry is fairly complicated. We do things like orthodontics, braces, we do gum surgeries, we do tooth replacement. So the things that you see in your everyday dentist, the scaling, the filling, that is the simple part of what we call the bread and butter part of dentistry. All right. When you come to this part of the world, once you come into the dental world, you would see a whole different, we make dentistry has become sexy. Those days when you went to a dental clinic, it's horrific, right? You had that little screen and the nurse is there, and when you enter, you can hear the drill sound. But today, when you go into the new age dentist, it feels like a spa. All right, so things have changed very much. The way we do dentistry have changed very much. Hence, I'm going to show you a good friend of mine. He's Dr. Gria, based in Indonesia, right? So he was recently last week here, and I took his video and say, look, this is a very good video to show you that dentistry is no more as boring as it used to be. All right, so let me just.
On a constant high, no ripples flow to the sky, to the sky. From when I know that currents flow through yours and mine. We do the same night, going through the motions, deep love and emotions. We gotta lost our minds. I look for it tomorrow. When it comes to horizon,
All right, so that's a very good friend of mine in Indonesia. He's sort of sorry, he's sort of the Michael Jackson of dentistry. He's kind of a celebrity in the dental world, right? He's got like, I don't know, a couple of million followers on Instagram, that sort of a joke, all right? So the way that you've seen dentistry before, and that's the video that I showed you, that's the new age of normal clinical dentistry, all right? You know, compared to the old days of boring clinics, boring work sounds and things like that, the new age of dentistry has changed it to be very aesthetically driven. So we do a lot of aesthetic work. We do a lot of, you know, we solve a lot of mouth diseases, but we still make it very cool. So it's a very fulfilling career when you sort of make a difference in someone's smile, all right? And that's something only a dentist could do. Now, when it comes to part way of how we do dentistry, right? So very simply, you could do, right now you're doing a pre-university or A-levels or whatever it's equivalent, right? And you join in dentistry. Now, the last I know is, it's quite of a tough credit. It's equivalent to medicine, dentistry, pharmacy. You know, you're in that sort of same qualification parameters, and you join dentistry. Now, dentistry, as I said earlier, your first year is very much mugging. Honestly, I suffered my first 2 years and I enjoyed the next 3 years, right? Because imagine anatomy and physiology. It was like reading a Greek Bible, right? First time you're hearing different parts of the body, and it takes a bit of mugging for the first 2 years. But on the third year, everything becomes clear because you start to understand your subject rather than memorizing your subject. The first 2 years, unfortunately, we can't run away. You know, you still need to memorize the subject, but eventually it becomes that you understand your subject very well. And eventually it's just purely understanding. All right. So right now, dentistry is a 5 years program in Malaysia, or in all over the world right now. In Malaysia, when I qualified, it was a 3 years compulsory service. Right now in Malaysia, it's a 1 year housemanship. That means you got to compulsory be with the government for 1 year. You could choose to do 3 years as well. A lot of people stick with the government for a while because, you see, fortunately or unfortunately, university doesn't teach you real world scenario. All right, it prepares you for the real world, right? But it doesn't teach you the real world scenario. So the best place to actually learn real world scenario is with the government. All right, like you know, during my university, I think I did about 10 extractions under, you know, I always had my lecturer beside me, right? So there was like a safekeeping, and I was not worried, and say, look, if anything goes wrong, my lecturer is there. But the first day of my government posting, I had nobody, and I had to do 80 extractions in day one. All right. So that sort of real world teaching sort of puts you in that shock system that, look, you can't fail. You need to figure it out. You need to learn. There's no more lecturers, no more teachers hanging on with you, right? So the government part is a sort of a very important learning curve. Even in the medical field, right? Everyone dreads when you speak about housemanship, right? The reason they put you in that torture chamber of housemanship is because they need you to be well versed with every single department. And, you know, if you don't go through that stress, you will not know how to handle yourself in further situations, right? So the government teaching, the posting is a significantly important journey, or I could say the most important journey right after graduation. A lot of people these days sort of leave after 1 year, and because, you see, honestly, to start off a private practice, it's not too expensive, it's not too difficult, right? Hence, that's why you see a lot of dental clinics mushrooming everywhere. All right. But the problem of which is, if you do not finish your government posting, or if you do not experience enough, it becomes quite difficult in private dentistry, right? So, i.e., the government years are your best learning years after university. Right now, after you finish the government posting, you could choose two options. One, like a lot of them did go and set up a private practice and do private dentistry. Some of them choose to specialize. Now, specialization in dentistry has become a big thing. Now, prior to recently, a lot of people didn't know that you could specialize in dentistry. But now a lot of dentists are going into specialty. Now, what do I mean of dental specialty? All right. The most famous of all dentists, all right? So actually this doctor, the reason I did dentistry was when I was 14, 15 years old, I had braces on, right? And my dentist had a Porsche. All right. So that was like, okay, I should do dentistry because dentistry can buy me a Porsche. All right. So the biggest sort of money generator in dentistry is always perceived to be orthodontics. Right, orthodontics is the braces. So what happens is after you finish a 5 years education, orthodontic program is a 4 years full-time master's program. All right. See, medical in medical. So my wife is a ONG doctor, right? So she finished 5 years of medical school, and she specialized, but she was working while specializing. She had just had to do paper 1, paper 2, and eventually go to UK for a while, and she qualified as a specialist. But for dentists, unfortunately, it's a 4-time full year program, which you could do it locally, you could do it. The UK and the Hong Kong are quite famous space for specialization. Usually, if you are lucky enough to get a government grant or a scholarship, they sort of pay for your full expenses in that. Orthodontics is very simply the science of moving teeth. All right, they treat everything to do with tooth movement. Kids with very funny teeth, and they need to position the jaws properly. There's another field of dentistry called pediatric dentistry. Now, pediatric dentistry, usually you would see them in hospital-based settings. So if you go to University Hospital or UKM or any government hospitals, right? There is a department of pediatric dentistry. Now you'd be thinking like, look, what does a pediatric dentist do? What do you need to do with the kids? Just extract the teeth? Well, it's a little bit more complicated than that. You see, with pediatric dentistry, there's a lot of preventive treatment that we do. There are a lot of kids that require different sort of treatment that is taken care of in pediatric dentistry. There's a lot of kids that we do dentistry under general anesthetics because that 5 years old won't sit down quietly on the chair, right? So the disease of the teeth has gone too much that we require extraction or some sort of invasive treatment. Hence, that's what the pediatric dentistry takes care. There is also in pediatric dentistry, a new subspecialist that came out, which actually takes care of special need dentistry. All right, so kids with special needs or adults with special needs, there is a specialty in dentistry that actually takes care of this need. Why do they need a different sort of care compared to a normal dentist? Is because we do a lot of preventive work, i.e. we place different things to sort of prevent any decay of that tooth for special need dentistry. Now, the other specialty, which is oral implantology, is very simply someone who specializes in replacing tooth through implants or surgery. There's something called dental public health. Those in the dental public health subspecialty usually works with the government. They sort of do different sort of plans, different sort of treatment agendas for us to allow it to work in. What they do is, for example, do you all guys know that your waters have been fluoridated? All right, so hence, why is your water fluoridated? Because the public health specialists have added or have decided that we should do fluoride varnishes into the water so that it becomes a bit more preventive. So public health, they don't treat one people, they sort of treat a whole group of people. All right, they treat a community. That's public health. You also have public medicine that treats viruses. They treat viruses like COVID, right? Other than the specialists in the lung specialists or infectious specialists, the public health guys are the ones that are coming out with a routine of, okay, look, we need to do this much of vaccine for this much of people. All right, so it's a sort of a mix of that both. Well, there's another specialty called endodontics. Endodontics are those specialized in root canal treatments. All right, now root canal treatment is sort of so for example, if a tooth is decayed, it's created pain, you need someone to do a root canal treatment. Now, the back tooth, sometimes it becomes a bit complicated. Hence, that's why we have a specialist that only does root canal treatment. And so forensics odontology, this is someone that works with, it's a specialty, but they're usually with the universities. What they do is forensics. All right. So if you've seen CSI or all of those investigation movies, right? The dental print or the dental print is a very important structure for them to identify DNAs and to find a person. In any air crash, the first thing they take is dental records so that we could identify before a DNA test and things like that. One more very important specialty that we sort of missed here is something called oral surgery. Now, oral surgery is one that is specialized in anything to do with operative, all right? So, for example, motorbike accident, they fracture the whole face. Who do they see? They see an oral surgeon. So what does an oral surgeon do? They fix the whole face, the muscle of the face, the fractured bone. So they work in a hospital setting because it's all 100% GE. What else do they do? We've got some patients that come to us with very bad jaws. Imagine the lower jaw is protruded too much, right? So they do aesthetics. That means they do a full facial reconstruction on that patient. That is done by an oral surgeon. We've got kids born with cleft lip, cleft palates, right? Who fixes the cleft lips and cleft palate? It's both the oral surgeon as well as the orthodontics, because with cleft palate and cleft lips, unfortunately the tooth is deranged, right? So you have an orthodontics fixing it and the oral surgeon blocking out all the cleft in that sense, right? Who treats face and neck cancer? Oral surgeon treats face and neck cancer, all right? And there is thousands more things that an oral surgeon takes care. Hence, they work exactly like in a medical practice. That's why as dentists, during my government posting, I was posted 1 year in a hospital. I was in hospital Selayang, and it was extremely busy. I mean, I clock in at 7 o'clock, I clock out at 7 o'clock at night, and I'm on call, on an active call, meaning that because there's always an accident that hits the face, right? And unfortunately, Selayang is in that MRR2 stretch, right? So there's a lot of motorbike accidents, and Hari Raya or the holiday sessions are my worst times because there's so many accidents, and you'll be doing one case after one case. All right, and so when I finished, I in the hospital, I had a call one day and says, look, can you come? There's an emergency, an accident patient. Now, when I went in there, I see the surgeon and I see the neurosurgeon waiting for a dentist to come in before the neurosurgeon. So I was confused. I mean, I'm like a young dentist just graduated. Why is a fully qualified neurosurgeon and an orthopedic waiting for me? Very simply, the facial accident fractured the upper palate, right? So the bleeding couldn't stop. So I needed to fix the top part of the teeth or the palate for the bleeding to stop before the neurosurgeon could go in and fix the bleed in the brain. So the oral surgeon plays a fundamental, important role in the whole medical healthcare system. So even if you go private, right? If you go to Pantai or you go to Subang Jaya Medical Center or Sime Darby Medical Center, right? You will always see a category called oral surgeon because they fix all of this, which is a fundamental, important part of everything. Periodontology is someone that fixes gums. All right. So yeah, you may be confused. Why do you need a specialist just fixing gums? Because gum disease is one of a rampant growing disease. All right. So they don't just clean teeth or scale teeth. they raise flaps, they put extra bone around the teeth, they keep the gums and the teeth healthy, right? So that's why there's a specialty in periodontology or gums. All right, now these are very, very clinical dentists, all right? A dentist that has joined dentistry and is doing something very clinical. Now, when you move on, other than clinical, what can one do, all right? For example, like for me, right, I always enjoy that entrepreneurship feeling. All right, that means I always wanted to be in business rather than a clinic per se, right? So I went into the pathway of being a dentist, but using my skills as a dentist, doing a lot of entrepreneurship stuff, right? So what I do is I run something called Dental Academy in Malaysia. Dental City is just a location of where this whole thing is. I run a group of dental clinics and specialist center. I run the, I also take care of something called 32 Clicks, which is literally the Lazada for dentists, right? It's a B2B platform. My group as well, we've created something called co-work sharing for dentists. It's called co-work dentistry. So it's very different, right? So that's me using my entrepreneurship cap, doing something different. That's the business element of dentists. Now, the reason why I did dentistry is because compared to medicine, see, medicine, yes, you can open clinic, you can do pharma business, you can do everything else. But my passion was always doing businesses or entrepreneurship stuff, right? So I felt dentistry had a little bit more bandwidth on what I could do with the knowledge of dentistry. Hence, that is one of my reasons why I did dentistry. In dentistry, you could choose to be a clinician, which the pathway I showed you much earlier. You could choose to be an educator, so you could specialize and start lecturing in universities and doing your post-grad research, whatever. Or you could be what I do. The business element in dentistry is quite a lot. You could be from supply business to literally owning dental clinic chains, and you sort of move into that direction. I believe even in medicine, you can do that. You can see groups like Medicareers, Qualitas, and all of them. If you look at their founder, they were 50% doctors, 50% business guys, right? That's how they grew that sort of chain of clinics and businesses. You could be a speaker if you would like to. A lot of people now that qualify for dentistry and says, look, I don't enjoy this clinical scenario, they join corporate companies. All right, what I mean corporate companies is dental principal companies, right? Supply or manufacturers. For example, a doctor joining Pfizer for vaccine. All right, so in the dental world, there's thousands of them, right? So doctors now have moved into that corporate field because most of the dental companies are all corporates, right? Huge corporations. So they join that corporations and go up the ladder to eventually be CEO of a corporate entity that deals with the business of dentistry, right? So a lot of people, it's not a close-ended, when you join dentistry, you only can be a clinical dentist. You have to be in that four walls, all right? There's a lot of different options where young dentists these days have moved into different direction. Now, why did I did good amount of dentistry clinical work for the first 3 years of my career, but eventually I moved into doing what I do today because very simply it's passion. All right, it's because you have to understand the decision that you make soon after your pre-university is something that you're going to live with it for the rest of your life. All right, so if you hate doing that, you will not be able to do it for a substantial long period of your lifetime. All right, now was I passionate about dentistry the day one I joined? No, but eventually once I joined in, worked in clinical, eventually I found my passion around it and says, look, I need to use my knowledge here so that I can enjoy doing the work, what I'm doing now. That's me finding the passion. So a lot of people do this mistake of accepting a job as this, right? If you're a dentist, you sit in the clinic and sit down and see patients. Well, that's not true. You have to find what you enjoy. Like you look at the guys earlier, Gria and all from Indonesia, they are passionate clinicians. They love changing people's smile. All right. And they will do it day in and day out without feeling tired. So for them, it's no more work. You know, it's passion. So it's you can clock in 12 hours a day and you won't feel tired because you enjoy doing it. For me, I did 12 hours of clinical for first 3 years of my life, and I was no, it's not for me. I enjoy creating new opportunities, and that's why I did the business aspect of it. A lot of them have become very good educationists, traveling the world, working in different universities. A lot of them work for big corporate companies. In my own classmates, all right. So they're all in. So if you look at a batch of 50. I could say 40 people are in clinical dentistry because they enjoy it. 10 people are doing everything else around dentistry, and they seem to enjoy it as well. So dentistry, whatever medicine, dentistry, you have to remember that the stereotype of what you think the profession is, it's a stereotype. It is what the majority does, but it's your decision at the end to find the passion in whatever that category could be, and follow that sort of passion in that sense. Yeah, right. So I believe passion in whatever you do, especially in dentistry, right? Because imagine if I hate clinical dentistry and I'm forced to do it for a good 30 years of my life, I'm going to be having depression every single day. All right. So if you do what you don't enjoy, you will not do it for a long period of time. And you can't afford that, right? So very simply, right now you've got to make a decision on what's your pathway in the future, right? Once you decide that, look, I would like dentistry, you've got to go through the mill. You've got to go through university. You've got to go through the first 2 years of struggle, 3 years of clinical dentistry. Eventually, once you come out, you could specialize in 6 or 7 different specialty. You could work in corporate, you could work anything. The thing that is going to make you motivated to do it is where you find your passion eventually. You can't find your passion today. Even I could not, being in your age, it was just a fluke shot for me to do dentistry, but eventually finishing it, going through the mill with it, and then I found what I liked and I concentrated in that. Same thing with my wife. She finished, she enjoyed medical school. She was one of the good ones. She knew that she wanted to do ops and gynecology. So she did ops and gynecology, but it was every day on call, right? So now she's doing something called subspecialty. That means a specialist of a specialist, right? In something called fetal-maternal, the doctor that does scan. And now she enjoys it because that was her passion. But she had to go through the mill before she found that passion. So very, very simply what I'm saying is, it is not now that you find your true calling. It's once you join in, be it medicine, be it dentistry, be it pharmacy, whatever it is, eventually you'll find one category, one part of it that you really, really enjoy. And you should focus on that element because that's the only part that's going to keep you okay for working 12, 14 hours a day. All right. So here's a small video that I sort of, it talks about passion, but I think if you listen to it, you would understand what I mean very much. Oops, sorry, guys. Oh, sorry, guys, I can't seem to play the video. Just 1 minute here. I'll just pull it up. screen?
Not yet, doctor. Not yet.
Yep. Can you see my screen?
No, we can't currently.
Can you see the screen now?
Yep, now can.
Okay. Yeah. Sorry, I don't know why I couldn't replay. Right?
Hmm.
People say you have to have a lot of passion for what you're doing, and it's totally true. And the reason is because it's so hard that if you don't, any rational person would give up. It's really hard, and you have to do it over a sustained period of time. So if you don't love it, if you're not having fun doing it, you don't really love it, you're going to give up. And that's what happens to most people, actually. If you really look at the ones that ended up, being successful, unquote, in the eyes of society, and the ones that didn't, oftentimes it's the ones that are successful loved what they did so they could persevere when it got really tough. And the ones that didn't love it quit because they're sane, right? Who would want to put up with this stuff if you don't love it? So it's a lot of hard work, and it's a lot of worrying constantly. And if you don't love it, you're going to fail. So you got to love it. You got to have passion. And I think that's the high order bit. The second thing is you've got to be a really good talent scout, because no matter how smart you are, you need a team of great people, and you've got to figure out how to size people up fairly quickly, make decisions without knowing people too well, and hire them, and see how you do, and refine your intuition, and be able to help build an organization that can eventually just build itself, because you need great people around you.
Thank you. Lynn.
I was lucky. I found what I love to do early in life. Waz and I started Apple in my parents' garage when I was 20. We worked.
Yeah, sorry again. Yeah, so that was sort of a small video from Steve Jobs, but I don't want to scare you now, right? So don't worry for where you're at now. The passion is very simple. Whatever you choose, right? Be it medicine, be it dentistry, you will eventually find exactly in which space, be it clinical or be it non-clinical, that you will enjoy doing. All right. And then eventually once you're passionate about it, you'll be able to sort of do it for a long period of time. All right. So dentistry, is it rewarding? Yes, it is. And okay, now where is the biggest in clinical dentistry? Where do you think is the biggest? End of the day, why are we working? It's for the money of it, right? It's for the finer things in life at times. Where do you think the biggest money is in dentistry? In which clinical expertise? So a lot of people, like when I was young, it was my orthodontist that really was making the big chunks, right? But honestly, you can't look at dentistry as a money-making thing, clinical at the start, because you have to be, it's a human-to-human business, right? So you're treating a patient. If you enjoy what you do, no matter in what field, money will follow. All right. So that's why I went back again, and if you're passionate about moving teeth, it's orthodontics. If you're passionate about the business part of dentistry, it's that part of it. Is it fulfilling? Yes, it is fulfilling. Must you be a dentist? If you're not artistic, can you be a dentist? Yes, you can. If you are artistic, does it make you a good dentist? Yes and no. It just makes you a little bit more, when you're designing smiles, you're a little bit more skillful. But can a non-artist do it? Yes, we can, because it's just about training. Do you need to understand the whole medical sciences to do dentistry? Yes. There is a reason they put a doctor in front of your name. It's just because you understand the whole medical sciences of the body to become a dentist. All right. So dentistry is very simply a balance between a doctor, an engineer, and an artist. All right. And I would, really encourage a lot of people to join dentistry if you are into this sort of the ecosystem or passionate about this. Right. So that's a very short presentation. Right. So is there any questions that I could sort of address in regards to dentistry?
All right. There are a few questions in the Slido link. I'll share my screen first.
Sure.
Hold on, yeah. Right. Can you all see?
Yep.
All right. So let's start off with the first question. So yeah, do you have any tips to help one decide what to pursue as a career? Because yeah, I'm pretty sure a lot of people are like stuck between this and that, like medicine or dentistry. And in this case, dentistry and pharmacy. So yeah, do
Okay.
you have any tips on that?
Okay. I'm currently stuck between dentistry and pharmacy, right? So I've got quite a lot of colleagues that are in the pharma division as well, right? My father-in-law is a pharmacist as well. Okay, so I can't say anything bad about pharmacists because my father-in-law is. I need to go home one day, right? So, so honestly, dentistry is clinical. There is a clinical component where you're treating patients, you're talking to patients. Pharmacy is very simply you are in the field of medicine and chemistry and all around it, right? My father-in-law, who did pharmacist, he was once upon a time the general manager for B Brown Pharmaceuticals. It's a huge pharmaceutical. If you're a pharma, you're going into not the normal pharmacy. If you're going into drug companies, it's a very corporate career. If you compare corporate careers, pharmacy is a better corporate career. If you're comparing clinical work, you will do more clinical work in dentistry. Pharmacy is just not working behind the counter and prescribing drugs. There is a whole different division to that, right? So if it's corporate, the pharma division is much stronger than dentistry. If it's clinical, dentistry is a little bit more clinical than pharmacy. If you are into the business of meeting people, seeing patients, that is very much dentistry. Yep. So both of it, I think it is a good choice in both. It's really what you feel that in long term you would really enjoy doing.
Right. Definitely, I definitely agree with that, Dr. Bala. We have another question here.
Yeah.
So what is the most fulfilling aspect of being a dentist? Because to be a like successful dentist, different people have different like meaning of being successful.
Correct. So I think the fulfill in the clinical part of dentistry, right? Removing someone's pain, because we are referred to as the pain doctor, right? People come to us when they are pain when they have some toothache, right? So stopping pain is fulfilling, but where is the most fulfilling part is because it's a human to human business. All right. So literally you become best friends with every patient that you see. So I have a relationship. When I was in clinical dentistry, I have a good relationship with every one of my dentists, right? And it becomes personal. All right. And once you fix a problem or you change their life with their smile, the difference that it makes. All right. So we've literally made what's that thing? Like literally a feeling of an ugly duckling becoming a swan, right? So we've done smile makeovers that changed people's confidence, changed people's life overnight. And I think creating that sort of aspect in someone's life, because it is just not the smile. Please understand, when somebody has a horrible smile, it affects them psychologically, it affects them emotionally. They're not confident to go out to the world, right? And you change that, you see a 360 approach of someone, the confident level, the relationship, the emotional level, it just goes skyrocketed. And eventually you're their best friend, right? So I think the most fulfilling aspect of being a dentist is very much that the connection, the human to human connection that you do, and the difference that you can create in one's life. So I think that's really fulfilling.
Right. Thank you, Dr. Bala, for that.
Sure. When during your housemanship, what are some extracurricular activities or work experience outside of school which are good for dentistry? Sorry, what are some extracurricular activities or work experience outside of school which are good for dentistry? All right, so a lot of people, anything that will make you a good communicator. Right, so I train a lot of dentists that I train something called business and dentistry, okay, where I prepare a dentist for private practice. Now, the biggest fear I have of one dentist, because you see, dentist medicine, right, we are very stereotyped and we look only in the science. Or if you got a toothache, you look at toothache, right? We don't see the person as a whole. So I spend a substantial amount of time explaining to dentists that we are the human to human business, right? So whatever activities or work experience I would like you to do and experience, because forget about dentistry, that's something you'll get in school and you will eventually be doing in your life, right? The experience that you need is the interaction. Unfortunately, you're in the business of talking to people. So any sort of experience or work experience that gets you communicating, gets you talking, gets you understanding the human behavior is a good prerequisite to make you a better dentist in the chest side. So, sometimes we see very quiet dentists. Doctor mau cabut gigi, they just cabut, they keep quiet, they don't talk to the patient and the patient leave. See, unfortunately, yes, they are good dentists, they did the job, right? But because they don't create the rapport, they don't create the connection, they are not perceived as a successful dentist in the eye of the society, right? So I would advise a lot of them to spend a substantial amount of time learning communication, learn the way to speak to another human. Find, Google, YouTube. There's something called science of persuasion, right? So how do you persuade someone to take your treatment, right? So there's a lot of human sciences that is required rather than just chabot and tampal and scaling, right? So I would tell everyone to sort of pre-dentistry learn communication. So do whatever it takes to improve your communication and building rapport with one another.
Yeah, I agree. I think with anything you do, I think that's actually one of the most important things to build out your reputation and all as well. Yeah. Definitely agree, Dr. Bala. Right. So here we have when doing your housemanship should you decide on the speciality to pursue?
Okay. It's not during the housemanship. You still can do the general paper, which is the paper one. It's soon after the housemanship. You would need to figure out what is the specialty, because you would do papers that if it's oral surgeon is a different paper, if you do ortho it's a different paper, right? So you got paper one, which is a general paper, and then eventually you have to decide what category or specialist would it be. And a lot of them once you start practicing every division, right? You do a bit of braces, you do gut, you do scapes, root canals, you do that. Eventually, once you go through the circle, you would feel, okay, I enjoy doing this. I would like to specialize in this. All right. So finish your houseman, go through the mill, go around, do everything, experience everything, and then decide, okay, I enjoy this. I would like to pursue this. So that will be a good time to decide on that specialty soon after you experience everything.
Yeah. Oh, yeah. All right.
Hmm?
Yeah. All right. Then we have, yes. Would it be better to do dentistry in Malaysia or overseas?
I presume this would be studying, right, or working?
I think both studying and working.
Okay. Now, would it be better to do dentistry in Malaysia or overseas? Okay, for education purposes, Malaysia is pretty good. It's up to world-class standards in dentistry for all the school, because we are all MQA governed, right? So our syllabus is following UK syllabus. The only difference that I feel like, you see, a lot of my colleagues went to India for dentistry. Where they had an upper hand is they had tons and tons of patients. So they were doing extraction and all, quite a lot. But those who went to UK didn't have that experience. But they had an experience of doing something called conservative dentistry, which is a lot of filling and talking to the patients, because UK's way of doing things, it's maybe a different way India is doing it, right? A lot of them went to Australia, they went to New Zealand. So I would say that the university will fix a foundation. The course quality is almost good in everywhere. But yes, if you can afford it, sometimes the university creates a bit of a prestige, right? Like Harvard or Oxford, or in the dental world, there's like King's College. It gets you a better, oh wow, you're from there, that sort of a feel to it. But in terms of quality, the other good thing is if you do dentistry in Australia, for example, right? You are right now in Malaysia. Moving forward, it means once you guys graduate by next year, you could do dentistry any part of the world. Literally, you could do it in Afghanistan or Iraq, no problem. But anyone qualifies as a dentist that comes back to Malaysia and wants to practice in Malaysia has to sit for an exam. Okay. You could be even from Harvard or Oxford from UK, and the guy beside you would have done it in Bangladesh, but both of you cannot practice in Malaysia until you finish the exam. But those who qualify in Malaysia, it's called a PQE exam. The exams is incorporated in their final year paper. So those who study in Malaysia sort of automatically qualifies to work in Malaysia. Those who qualify from overseas, it could be a very good education, but since once you come back to Malaysia, you still need to sit for the entrance exam. But that being said, if you qualify from Australia and you plan to work in Australia, an Australian graduate or a UK graduate can practice in Australia, where else a Malaysian graduate will need to sit for an exam and some papers to qualify to work in Australia or Singapore or whatsoever. So that's the two pros and cons of doing it in Malaysia and overseas. Practicing dentistry, yes, it is rewarding in Malaysia. Overseas, the thing is that, see, in Malaysia, we produce a lot of dentists, where else in the UK and Australia, they don't have much dentists. So it's a lot of, you could get a good, there's a big demand for dentists in the UK. There's a big demand of dentists in Canada. So if you're looking at migrating, you will always have a job somewhere else in a different country, right? Practicing Malaysia has come up to world class in dentistry. So the standard of care is equivalent in both. But yes, you could choose either or. Really depends on your life plans.
Right. Yeah, just a follow-up question. You said that Malaysia's education in dentistry is actually a world class. So like, which university in specific would you recommend?
Okay. There is 12, if I'm correct, if I'm wrong, there's 12 universities in Malaysia that has dentistry. Okay. I qualified in a university called Ames University, which is in Sungai Petani. It was a shock because I was bred, I schooled in Subang. I did my college, everything here, and suddenly I ended up in Sungai Petani in Kedah. It was a shocker because imagine city boy suddenly thrown to university in a kampong, but I enjoyed every moment of that experience, right? So in terms of school, there is a lot of school. Ames University is one. IMU is doing very well. Good amount of lectures. Masa University is doing very well. Segi also has a university. I'm not sure. Taylor's doesn't have a medical school, right? You guys, do you have a medical school?
Yeah, we do medical school.
You don't have dental school, right?
Dentistry, I'm not too sure, but medical, yeah, we do.
Okay. So in Malaysia, you've got a lot of them which are good. I mean, Segi is good. Yeah, the big fours are AIMS, IMU, MASA, Segi, Penang International Dental College. That are the private universities around. Everything else is government university, which it may be a bit of a difficult to sort of qualify or get in with pre. I think the government only accepts the government matriculation or STPM, right? So I think your option will be one of those 5 public private universities here. Where else, if you're looking at overseas, New Zealand has very good school. Australia has very good school. The UK, always being the education champions. They've got a lot of schools. Yep. So it's literally, IMU is right in KL. Okay. Manipal Melaka. That's also a very, very, very good school. It's based up in Melaka. Sungai Petani is AIMS University. Penang is Penang International Dental Conference. They all have the same prerequisite. So, very simply, your undergrad days, right, just gives you a foundation. Your real teaching circle starts right after that. You really learn after your schools. All right. So all of them, because I see students from IMU, I see students from UITM, I see students from everyone starts together at the same path. But it's what you do after that differs you in the real world scenario. All right. So I wouldn't be biased as I'm saying most of the schools are qualified and are as good as you all will come out with almost the same level of competency in dentistry.
Yeah. All right. Thank you for that. Yeah, what subjects can we see from our pre-U coming in handy during our dentistry degree?
Okay, the first 2 years will be definitely everything in your pre-U. I'm sorry, I'm not sure in pre-U. Biology, definitely. There's a whole division in medical health called biochemistry, which is your Krebs cycle, your glucose cycle, and all of that. So a lot of biology. I think biology will assist you in your next moving forward. I think that's the only subject in pre-U. I don't remember using any mathematical formulas in dentistry. So yeah, if that is, then it's engineering, right? So the biology, chemistry part of it may help a lot in dentistry. Can you do a training program for dentistry similar to medicine? Yes, you can. Not many universities do this training program. Good thing is the people who champion it is actually IMU, where you could do 2 years here in Malaysia, preclinical in Malaysia, and the next 3 years you could choose the country that you would like. You could do it in Australia, you could do it in UK, you could do it in they've got quite a lot of universities, right? The good thing is you get doubly qualified. You qualify in Malaysia and you qualify in that country. But that being said, when you choose that option, there's 2 things. One, you still got to come back and do the exams locally. The other thing is, unfortunately, PTPTN, which is the government the sort of education fund, they don't support any training programs. The PTPTN will give you money to study only if you do all years in Malaysia. So that's the 2 not very good things about training programs. But other than that, look, if ever you feel like marrying someone from Australia, you have a ticket to work in Australia, all right? So i.e. that's the basis for training programs. But it gives you 2 different experiences, like your experience Malaysia, your experience Australia, and then eventually you would know what it takes.
All right. Have you ever been stuck between deciding if medicine will be a better catch than dentistry?
Well, yes. I think when I was exactly in your shoe, I was, typical parents, right? You're supposed to be a doctor. Medicine there was no medicine, there was no choice of medicine, dentistry, or pharmacy. It was die, just become a doctor, right? So you were stuck. That's why I went into pre-med, and my only escape out from medicine was dentistry. So that's why I did dentistry, right? Because I really didn't want to do medicine. It is not that I didn't like it or enjoy it. I just didn't see myself in that shoe. All right. So the reason I am a dentist today was because I had nowhere else to run other than medicine or dentistry. So I went back and said, hey, still doctor. All right. So that was my comeback to that.
Would it be bad? Oh, wait, you've done this. Sorry for that. Yeah, do you have any tips for the pathway to studying overseas?
Okay. For studying overseas, the pathway is right now you're doing your pre-medicals, right? Or pre-qualifications, your A levels per se, right? Uh, you see, the thing with studying overseas, right? Here you are fighting for a seat. Here you're asking, they are rejecting, oh, we're full and things like that. But when you want to study overseas, right? They really want your money. So they will do whatever it takes for you they will show you the best hostel and give you everything you need to join them, right? So I think the prerequisite is because is to do well in your pre-university. It's just that this pre-university part that you really got to get your marks up. After that, your pathway is very simply decide on a country first. All right. Rather than deciding on a university and figuring out a country, decide on your country. And in that country, you will have the top 5 dental schools. And like in Malaysia, right? Like say AIMS or IMU or whatever, right? We have a quota. Okay, we got 100 seats. 80 seats is for local, 20 seats is only kept for international students. So you guys imagine the table turn, right? If you guys are going to Australia, there is seats allocated only for foreign students, and they will do whatever it takes for you to take that seat, right? So decide on the country, and then find the top 5 dental clinics. What you're doing now will qualify you anywhere in the world, right? So get that 5 universities, and then decide which of that 5 you should you should join in. Usually, I think that the different countries has different intake. Most of them do a September, October, November intake. So if you could, I'm not sure when's your results are out, but if you could, but you're also going to enjoy life, right? So when you go there, it's 5 years of no break again, right? So a lot of them take a short break between pre-U and U, right? So if you're okay, have your short break and then try to see which university coincides with that intake.
Yeah. All right. Thank you. What do you think is the most important value a dentist should have?
I think the most important value is really you need to be a people's person. You need to have that human to human reaction, and it's not wrong for one not to like that. All right, some people are just they just don't like to talk very much, right? They don't like to communicate. They don't like to create that bond. Unfortunately, in dentistry, in medicine, you're not just dealing with a teeth. You're dealing with another human, right? So understanding their psychology. It is not about the work. Your patients really don't know what you're doing at the back of the teeth. Done. Right. So the patient don't really get it, right? But patient knows how you treated them. Patient knows the value, the communication, that sort of soft touch that you have. And that's the only one that will make you sort of quote unquote successful dentist, is the way your patient leaves your practice and tells the whole wide world to come back to this practice. All right. So the most important value a dentist should always have is the ability to communicate, the ability to make sure that the other person is very comfortable in their hands. So it's that thing that it really needs.
Yeah. Right. Can you expand more on your experience during housemanship? Oh, for this, I would like to also know if you've ever regretted joining in dentistry, or maybe you regretted you should have joined. You should have just straight up to MBA from the very beginning.
Okay, no, I because you see, you can't. Can you I I have no regrets, honestly, no regrets, right? But as I said, life is a journey, right? So if you don't go through this journey, you will not know how it feels to be at the other end, all right? So the you experience during your housemanship, it was an amazing experience because that's that journey, right? You are young, you are naive, you only know textbook teaching, and here you are in real life scenario. Uh, you took out, you extracted 10 teeth in university, and first day you're taking out 80 teeth. You're dealing with complications, you're dealing with bleedings that don't stop. You're dealing with hospital cases where patients are almost dying and you need to do something. uh, so the housemanship experience is tremendous, and that sort of builds you as a person, because you have to go through that mill of doing that whole 9 yards, and then coming out of it and looking at it and say, okay, yeah, I enjoyed this, I didn't enjoy this, maybe I should do this. So it's a very good teaching curve. See, unfortunately, it's not written in a textbook. You have to go through it to experience it and then decide what you really would like. So if you ask me, do I regret it? No way, Jose. Did I enjoy it? Every bit of it. And that's the part of life where you, it's first time you're earning your money, and it's a different feeling at all, right? So enjoy and really enjoy that moment.
Yeah, thank you, Dr. Bala.
Yeah.
What kind of lifestyle can you expect in pursue dentistry? If it's going to be a more relaxed one compared to medicine, or is it probably much the same?
It depends on what. See, it is still hard work, right? There's no way of running away from hard work. Okay, so if see, a lot of people took dentistry. I remember in my batch, because and that's why you see a lot of ladies in dentistry, because it's perceived that, okay, it's good for me when I'm a mother, or it's good for family life. True and not true. Clinics are no more 9 to 5 these days. There are long hour clinics. The lifestyle you can expect would be, you would have a very good mix and blend. Okay. I mean, I'm not being biased here. I think I have a better life than my wife. She's a ONG specialist. But her passion is delivering. Her passion is in that, right? I'm 9 to 5 and I'm chilling on Sundays, but she's on call sometimes, right? So if you compare in that way, maybe I've got a good life. But if I compare with good karmas, I think she's got better karmas than me, because she's doing good for a lot of people, right? So the lifestyle, well, you quite have a good, decent lifestyle, clinical work, you can have your breaks. Very simple. You earn a lot when your hands are working, right? Some people just continue working because they don't know how much to earn. Some people will do 1 week of work and say, look, I made enough, I'll take 2 weeks off. All right. And you can do that in dentistry or in practice, right? So it's really what you're looking at lifestyle. And I think, yeah, most dentists I know, they've got a fairly good lifestyle. They eat in their best places, they drive the best cars. So yeah, but I said karma, maybe the other side is better karma than you.
Right. Yeah, that's all of the questions we have for today. All right. Hold on. Give me a second. Sorry, hold on. All right. Yeah. So thank you, Dr. Bala, for your time and your presentation, the Q&A. Everything was really, really informative and knowledgeable, really helpful. I hope it helps those who are here today to now have a clearer idea of the pathway of a future career in the field of dentistry. Yeah, so thank you so much.
Very good. Thank you so much for having me. Thank you so much for listening to me, actually.
Right. Okay, so the feedback form will be sent in the chat box. Don't forget to fill that out, as certificates will only be given to those who fill it out. By filling out the feedback form, you can also have input in TLPMC's future events and let us know where we can improve. We hope that these events help you all to have really greater insight to attain your dreams. Right. Furthermore, as displayed on your screen right now will be, yeah, as you can see, it's TLPMC social media pages, which you guys can scan and check it out to keep up with our club's events and activities. All right. Before we end this session, hold on. Yeah, there we go. Here are our future events for the entire week. As part of dive into Medicareers, we'll be hosting the following events. 21st will be neurosurgery by Dr. Rajendra, 22nd psychiatry by Dr. Harinder, and 23rd pharmacy by Dr. Ranuka. And also our own very tailored student, Angelina Wan, will be also giving her point of view of it as well. All right, yes, as always, thank you all for joining us here tonight. We hope that you enjoyed yourself and learned something out of this. Thank you. Have a great night, everyone.
All right. Thank you, guys. Good night.
Thank you.
Thanks.
Thank you. Bye bye, everyone.
Bye. Good night.